When you have aphasia, it can feel devastating and hopeless. Talking is critical to relationships. We use words to get information, we make decisions, or asking for help. Without language, it is hard to know how to do all these things. I would hope that after this, that you would understand, one, what aphasia is, and what other people who have aphasia say. What is aphasia? Well, before we get to that, let me share with you. I have aphasia. I had a stroke 2.5 years ago. Now, I take it as a compliment when some people say you don't sound like you have a stroke. Well, I don't know what it's supposed to be like, but I deal with it. There were some times when I'm writing or even doing this video, I'm going to mess up. But you know what? I'm not worried about it. And I'll have fun with it anyway. Aphasia is when you have trouble talking after a stroke. Aphasia can also happen from a head injury or brain tumor. Besides talking, aphasia can affect the ability to read, write, understand what people are saying. We're not crazy. We know what's going on. Will the aphasia get better? Will I ever get back to being normal? If you have aphasia, you've not lost your words. The words are still there. They're stuck in our brain. The problem is getting your brain to access that information in your brain to where the words are. However, you can usually get back to at least some of your words. Some doctors or even speech pathologists or whoever, or counselors, they may say, oh, he'll never speak again. Or they may say, you will not have any more after your 6 months of recovery, or a year, or 2 years. As far as I'm concerned, that's not true. Recovery from a stroke, recovery from a stroke continues as long as you live, and as long as I live. People have recovered their normal language. Some people have done it in months, or years, or even 10 years or 20 years, but it can happen. As I said, I've been at it for 1.5 years now, and I have a long way to go. Keep on trying and never give up. Recovery depends on 3 things. Where the stroke happened in your brain, how big the stroke was, and how hard you work to recover. If the stroke happens in the middle of the language area, more language will be affected than if it happened, say, further away from that. So it can take a little longer to recover. However, usually the brain is good at compensating for a small stroke, no matter where it happens. The larger the stroke, the harder it is for the brain to get that information and to compensate it. There are no connections that are broken here. However, it is still possible to learn other ways to communicate. The more that you try to talk, the more you will recover. The people that make the most progress are the people that force themselves to talk as much as possible. It makes sense. Your body doesn't get stronger if it sits in a chair all day. You have to use the muscles to make them stronger. The brain is just like the same way. The more that you use your brain to talk, the stronger it will get. I want to give you some practical type tips for communication. For some people, use a mini photo album or a word list of things that you talk about the most. Use them when you use a new topic. Use point and use gestures if they aren't enough. I use it all the time. And when you're talking, the conversation, remember, it's a two-way conversation here. Allow extra time to talk. Get rid of any distractions. Turn down the TV, turn off the radio, turn off the movies. Turn away from the air conditioner or the washing machine or the dishwasher. Try not to talk in the street. Just get rid of those interactions so that you can work on that conversation. If need be, use pictures and simple drawings. Write down the key words that are the most important ideas in the conversation. Frequently, or check frequently to see if the person is understanding you. Sometimes you'll have to ask 2 or 3 times to make sure you understand, but you know what? You'll get there. And if they don't understand, try to have them say another way or another word. Be flexible. I use a thesaurus a lot to find another word. Remember that it can be frustrating for everyone. So at least be calm. And if anything, keep some sense of humor. The voice of experience, well, what people from hearing from people with aphasia. I've heard some people who have been dealing with aphasia. What should people say with aphasia? No. Well, here's what I've been told and that I pass on. It is tough to deal with aphasia. Don't give up. Don't avoid friends. Don't avoid them. Do everything to communicate. Don't run away. Take risks. Participate in any conversation, any way that you can. Be patient with yourself. Some friends won't call me anymore. It is hard to lose people who thought they were your friends. But some people are also not comfortable with it. The person with aphasia may have a lot of feelings. They may be angry, frustrated, and embarrassed. Don't take it personally. I hope these few points will be there to help you. Thank you.